All right, what we're going to see in this next clip is our financial secretary, Mary Longoria. The first time we've got to see her in a public appearance. And, well, see it for yourself.
Good morning. My name is Mary Longoria. I'm the financial secretary for Amalgamated Transit Union Local 757. I want to thank you for giving me the opportunity to speak with you on a basic issue of fairness regarding the TriMet pension. I do so on behalf of the union retirees and future retirees that TriMet continues to blame, in part, for its ongoing financial problems. In Neil's interview with Jeff Gianola on KOIN Channel 6 last week, Ford Farland described a number of details about the union workers' retirement program, including 10-year eligibility, the option to retire as early as age 55, having the same health benefits as active employees under age 65, and then followed by Part B Medicare coverage. While all of that sounds generous, no actual dollar amounts were included in Mr. McFarland's comments, and I believe there is a good reason he left them out. The inconvenient truth is that these retirees receive pension checks so small that retirement can hardly be considered as their so-called golden years. I would like to share with you a financial breakdown of benefits and health care spending for a member who retired after 13 years of service. The former employee receives a monthly pension of $749. Before I continue, I invite you to pick up a pencil or pen and follow along as I do the math. I have rounded the numbers to make it easier. The retirement payment they receive is $749. In federal taxes, $57 is taken out. In state taxes, $72 is taken out. In Regent's health premium, and yes, to contrary, our retirees do and our active employees do pay a premium for health costs, and that is $182. For dental, it is $3. The net after taxes and health insurance premiums is $435. But that's not all. Their average cost for medications a month is $50. That leaves a total deposit for their family budget at $385. Now compare $385 per month of retirement income to the $16,000 per month retirement package of TriMet's former general manager. I ask the board and the members and the public to let these numbers sink in and conclude. As Mr. McFarland wants you to, that union member retirees are breaking the bank at TriMet. It is simply not the case. Given the relatively modest pension these retired union employees receive, it is unconscionable to even discuss additional cuts to their retirement during the upcoming negotiations. I ask the board to consider the fairness of TriMet executives' golden parachutes when they come to the expense of retirees' golden years. Thank you.
And that was a excellent speech by Mary, and it illustrated the truth of the situation of the union employees, while McFarland and his cronies and his board cronies all harp on the anti-union bandwagon as if we're getting so much. The truth of the matter is we don't get anything. I'm living on $700 a month. Of course, people say, well, I got to retire when I was 58. Well, that's true, but try living on $700 a month. I bet you can't do it. So there you go. No, the truth of the matter is that it's basically a lie, all of this anti-union stuff. You can spend 30 years at TriMet and get maybe a $2,000 a month check, and you know, Fred spent 10 years here and had 16,000. And why the public doesn't track on this injustice is beyond my understanding. They see the raises for the six-figure executives. They see the $16,000 a month Fred Hansen pay. They see all that, but they don't, for some reason, they don't track on the basic injustice that's going on here. They keep coming back to the union people. So the propaganda has so immersed the population that they've lost their sense of rational thought.